The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38 85 2397 or visit www.bahrainmediacity.com.
Good evening everyone. Welcome back to yet another episode of BMC Global Live Alhilal Health World, Nothing But Lifestyle. I am Anupama Menon. Belated happy Eid to all our viewers. I hope all of you had a wonderful Eid and a fantastic time with your family and friends. Health is a relationship that you have with your body. We devote so much of time and energy to nurture beautiful friendships and family relationships. In the same manner, it's extremely important that we tend to our bodies with loving care and give it the attention that it deserves so that we can enjoy good health. In this talk show Health World, we have expert doctors from various fields providing valuable information on various medical topics because your health is our concern. Today, we are happy to have with us Dr. Mohammad Rashid Taj, Specialist Internal Medicine from Alhilal Hospital, Hamad Town. He comes with an experience of over 14 years in the field of internal medicine. Today's topic of discussion is GERD. As we all know, a lot of us grapple with different kinds of stomach ailments and digestive disorders, be it acidity or heartburn or even bloating. But today we will focus on one of the stomach ailments, which is GERD. So let's go over to him and find out more about this. Doctor, welcome back to the show. Thank you for joining us.
Good evening, Anupama. How are you?
I'm fine, doctor. And how are you doing?
Alhamdulillah, I'm also fine. Happy Eid to everyone. And
so I guess Eid, one of the main things that we do during Eid is to feast on biryani and kebabs. You know, it's a time to, satisfy our taste buds. And then along with that comes a lot of stomach issues and problems also. So I guess this is the apt time to discuss about GERD. So heartburn, what exactly is heartburn? Is it the same as GERD? If you could just explain it to us in detail.
Okay, first going to this topic, we will go through some basics. Just imagine, I want to make our viewer know what is acidity and what is the pH level and everything. So, if we talk that acidity, acid in our stomach is, it is, the level is 2, pH level is 2. So, how can I explain that? Is like if we pull out the acid from our stomach and put a small blade in it, it will melt.
Okay.
So, it is such an acidic area. So, GERD, acid reflux or heartburn. Heartburn is nothing to do with heart, first of all. So, it's like the acid which should be in stomach is regurgitating back to the food pipe. So, causing an effect on the heart, a food pipe, which will give you a heartburn like features. Now, if we talk about that, why it is coming back, it is coming back because if there is too much acid, or if the acid doesn't remain in its place due to lax or relaxing of the sphincter. We have a sphincter in our esophagus, lower at the end, below the stomach, that has a unidirectional movement. So, if we take food, it should go down. If it is not going down, or if the sphincter is relaxing, if it is not closing properly, or if it is closing properly and after, due to some reason, it's leaking up. So, the acid which I have told you is such an acid, has a pH of 2, will come back in the food pipe, giving you a heartburn or acid reflux. GERD, acid reflux and heartburn is somehow interchangeable, it's the same. But if this persists for more than 2 weeks, we can say it's a GERD, that is gastroesophageal reflux disease or disorder. So,
okay. So, a lot of times we actually mistake heartburn for, maybe a normal causes due to indigestion or excessive eating. So, how do we actually know whether it's heartburn or GERD? Like you said, maybe more than 2 weeks, if it's persistent, then that heartburn can be categorized as GERD. Anything else to be noted?
Actually, if someone is having heartburn, over the counter of medicines are available, like everyone knows Gaviscon, Nexium, and these are over the counter medicine. If we take this acid reflux will suppress and heartburn will suppress, but if it doesn't suppress after taking these medicines also, it's we can define this as a GERD. So,
if it doesn't subside with medicines and if it persists for more than 2 weeks, then it's not a normal heartburn. It can be categorized as GERD.
So, and we should seek advice of an expert if it is persistent, and even I can say that if you are taking medicine for heartburn more than twice a week, then also you should go and seek advice of an expert, because it may not be a normal heartburn.
So, you spoke about some medicines which are available over the counter. So, if you could just throw some light on what are those medicines that will help in reducing heartburn, which are the ones that are normally used?
Okay, see what these medicines do. I will tell you some basics about this medicine. There are 2 types of medicine. One is which will reduce the production of acid, and another is another is whatever acid is there in your stomach, it will neutralize the pH. So, all of us know the pH of water is around 7. So, lesser the pH, more acidic the content is, and more the pH, more basic the content is. So, if we put like Gaviscon or any aluminum oxide or any calcium like thing that will neutralize the pH, and milk of magnesia. All these are available as a liquid form, in a liquid form. Apart from this, proton pump inhibitor and H2 blocker, these are two classes of drug which inhibits the secretion of acid. And Nexium or omeprazole, all the prazoles, you know, that omeprazole, pantoprazole, all these medicine are over the counter medicine. You can just go to the pharmacy and ask them and they will give you. And
so when is the right time to consult a doctor?
As we have already discussed, that if you are taking more than twice
a day or twice
a week.
Okay.
If you are taking more than twice a week, if you need this more than twice a week, you should go and consult a doctor. So rather taking this medicine for the longer period of time, it may have some side effects.
So the medicines that you mentioned now, are those antacids? Are they called antacid or?
Yeah, they are called antacids.
So what are the long-term effects of taking antacid? Because actually what happens is most of us stock these medicines at home, and as and when we require, you know, we don't even think twice. We just have pop in a tablet, or we have 2 teaspoons of the medicines and then it subsides. But not many of our viewers would be aware of the long-term effects of having antacids.
See, we have already talked bad about pH now, so I should say why this pH is important, why that 2 pH is important. You know, so to maintain the normal flora of our stomach, to maintain the normal flora, we need such pH. If the normal flora of our stomach, that is 2, won't be the pH that is 2 won't be maintained, the bacteria, the unwanted bacteria will grow up, and the most common bacteria which the most common is H. pylori. H. pylori, all of us has an H. pylori in our stomach, but it is in inactive form or it is in dormant form. But if the pH reduces, means if the pH goes toward the basics and from acid to basic, so that H. pylori will be in active form and causes ulcer in our stomach. So to maintain the pH around its own, the acid around its own pH is very important. And again, this pH is very important for the absorption of the protein and food what we eat, and breakdown and digestion of this food. So another thing is this pH is also important for absorption of the micronutrients and the vitamins, especially vitamin B12, you know. So if we keep on suppressing this pH, if we take lots of antacids and without thinking, the people are taking antacid rampantly. They are taking every day, and they are thinking that this won't affect, but if we keep on taking, we will be having a chronic diarrhea. The absorption will be hampered, no? So we will be having a chronic diarrhea, and a different type of gastrointestinal infection will be there, and the most common is H. pylori, that is jartoma in our common Arabic language, and I think most of our viewers know this. They are familiar with jartoma. Apart from this, they will be having like bloating of the abdomen and deficiency in the micronutrients, vitamin B12, and after certain period of time, they may also land up in osteoporosis. So if someone is taking, so I will not recommend a long-term use of PPI or any antacid without consultation of the doctor, because it may lead to lots of complications which will affect our health in future. So these are the few things because of which we are seeing too much of bone pain, body pain at the old age. People are having too much of gastrointestinal problem because in the young age or in the they are taking unnecessary medicines. Just they are popping up lots of antacid. This is very, very common nowadays, and this practice should be stopped, or this practice should not carry on.
This is actually very useful information because a lot of us don't have the awareness. We don't think twice before taking the medicines, you know. We just look for temporary relief. But now, according to what you said, it can lead to a lot of other major complications and even osteoporosis, which can affect the quality of the life. So, in your opinion, antacid for a short period of time or maybe under the doctor's guidance is okay, but long-term use has its own negative impacts. Doctor, is it linked to the food habits? Because a lot of times when we take spicy food or too much of oily food, that is when the heartburn comes up. So is there a direct link between the kind of food that we eat and this problem?
See, the heartburn or acid reflux won't come like this. It has its own aggravating factor. So stress is one of the commonest aggravating factor.
Okay.
If someone is in stress, yes, there will be reflex. There will the relaxation of the lower esophageal sphincter, that is a valve, and the acid can come up. Apart from this, yes, food has a very important role to play with that, like spicy food and oily food, spicy fried food. Apart from this, a high carbohydrate food and a fatty food. And if we talk about a bad vegetables, it's for acidity, that is tomato. So tomato is not good for acidity.
Acid reflux.
And the misconception is when we have acid reflux, we just take a glass of lime sometime. But lime, citrus fruits, oranges, these all are bad for acid. So grapes, these all are bad for acid. And even peppermint, peppermint has a tendency to relax the esophageal sphincter again, and the food from the stomach will again move up in the food pipe, that is esophagus, and we will have a heartburn or acid reflux. So peppermint, mint, which we usually take whenever we have heartburn. I have seen people taking a glass of lime, and apart from this, salt and pepper, that we put. So pepper is a spice, and we are again in every restaurant we are going and putting just we will order a non-spicy food and put some pepper on it. And so apart from this, yes, alcohol has very if I put of food and drink, according to the effect, alcohol will be on the top. So alcohol is one of the most dangerous thing for acid. So alcohol should be avoided if someone is having acid reflux. Apart from this, smoking is the another cause for more acid reflux. And again, caffeine, coffee. Every day in early morning, what we do, we have a cup of coffee.
Yes.
And that coffee is again a
It aggravates.
aggravates a known risk factor for the acid reflux. And decaffeination has been done, a study has been done that a few people has been decaffeinated, though, so the pH level was very much maintained, the acid level in the food pipe was very much maintained. So what we should do is early in the morning, in spite of taking coffee, we should go with some food which is good for the acid and good for prevention of acid reflexes. So,
So alcohol, smoking, stress, caffeine,
alcohol, smoking, stress, caffeine, citrus
and
food.
some of the fruits, tomatoes and citrus fruits. Especially I think lime juice, because lot of us have this on an empty stomach because it's supposed to have weight loss benefits, actually lime juice and warm water. So I guess when someone is having acid reflux, it needs to be avoided.
Yeah, and yes, you are talking about, so obesity is also a cause of acid refluxes.
Okay. So what are the complications that this GERD can throw up? Is it going to be a life-threatening if it's left untreated? What are the health implications that this could lead to?
See, if acid reflux is not untreated, it will first of all, it will cause esophagitis. That is, your esophagus will get inflamed. If it get inflamed, so after a certain period of time, scarring will happen, and scarring will reduce the caliber, reduce the area of the esophagus. Again, if it is not treated, again if it is not treated or not taken care, that normal lining of the esophagus will be damaged, and again if it is damaged for a prolonged period and acid attack keep on happening on that area, it may lead to cancer. Yes, it's the incidence is very low, but still
the risk is always there.
The risk is always there. It's not that low also, but yes, the risk is always there. Apart from this, like chronic cough, like acid is going again through the throat, and there will be a chronic cough,
dry cough,
and if it is not treated, sometimes that acid may go into the lungs and give the patient may land up in pneumonia. And apart from this, there are some sore throats, some diarrhea, and so lots of problem like which will hamper the normal lifestyle of the people is there. So you know, the most common cause of dry cough is this acid reflux. One of the most common cause of dry cough is acid reflux.
We always think that it's something to do with your respiratory system or maybe a cold or allergy, but
no.
This is,
if someone is having chronic dry cough, we should rule out acid reflux.
Okay.
So it has its own risk factors and complications.
It has to be treated at
Yes,
any
it has
cost.
to be
Medical intervention at the earliest is suggested to prevent any further complications. And what about heartburn in pregnant women? Because a lot of them say that during their pregnancy this tends to be more, you know, the heartburn and acid reflux. Is there any reason behind that?
Yeah, in pregnancy, mainly at the third trimester, that is the end of 3 months, there is lots of hormonal change, and already the girth of stomach, abdomen has been increased. The uterus will now start pushing the stomach upside, and once it will start pushing the stomach upside, there is lots of chances that content from the stomach rushes back to in esophagus. So in the third trimester, we always find a pregnant woman complaining of this issue. So what she should do is she should take a small meal, rather taking a 3 large meals. She should divide her meal in a 5 time or 6 time, 7 time. 5 time is ideally recommended, and she should not take again oily and fatty food, and before going to bed, 2 hours before going to bed, she should avoid taking food, and again she should not lie straight on the bed. That head end should be up than the foot end.
Okay.
And
so slightly raised, the head should be slightly raised.
Slightly raised. So and avoid unnecessary medication.
And does heartburn occur in children as well, or is it seen only amongst adults?
No, it's seen in children.
Children also have
it is more common in adult, but in children also, in infant rather also, we can see the heartburn. So it's very difficult for someone to say or diagnose. The children will not say that he.
They will not be able to communicate properly. Yes.
So we as the parents have to understand. So if it's a milk feed baby, if you see that while feeding he or she is just curving his back, or is just trying to squeeze his back and bone, it is one of the sign. Again, after feeding, if your baby is coughing, again you have to be cautious, and if someone is after feed, if the child is vomiting, and if having a chronic cough, and you should be apart from this, if someone is having wheezes, you can listen a sound from that lung, that is a whistle sound. All these things you should be careful, and just think about the acid reflux, and we can go to the doctor and seek a medical help. They will do a certain test and tell you whether the children is suffering from acid reflux or not. So it's not that uncommon, but yes, you find this complication in the children also.
So what is the treatment options available for GERD?
Precaution, first of all, precaution. So food habit, we should maintain our food habit. We should avoid the aggravating food, like already told you, alcohol, caffeine. We should change our breakfast habit. First thing should not be a coffee in the morning, coffee or tea in the morning, and we should cut down coffee and tea if we are suffering from heartburn. And apart from this, there are a few good food for acid, like among that ginger is one of the most common good food. Again, yogurt is another common, and having a good bacteria in it, and very good for your acidity. And apart from this, a high protein rich diet is another good, and non-citrus fruit like banana, apple and pears, watermelon, they are also good for the acidity. And you should take oatmeal in the morning, rather taking a bacon or a cheese, or
more fibrous,
and more protein
based diet
rich. And again, apart from this, stress, you should maintain your stress level with proper yoga or meditation. And then a tight cloth, you should avoid wearing a tight cloth if you suffer from
that also contributes.
That also contributes, because your pressure in the abdomen is pushed up, so which will lead the gastric content from a stomach to go in the esophagus. So then obviously again I will say alcohol, smoking and caffeine. Apart from this, this PPI and H2 blocker and some antacids are the medication available, and you should be taking according to the doctor's advice. In some very serious or very severe cases, we go for a surgery like fundoplication and other surgeries, bariatric surgeries also. So your doctor will decide. They will, how they will know that there is small diagnostic procedure. So they will put a strip of pH level to measure the pH, a pH probe through your nose to the esophagus, and they will measure the pH.
Is that done through endoscopy or how?
No, normally they can do this, but yes, the other way is endoscopy also. So to collect the pH, to know the pH in the esophagus. Esophagus pH is not as low as stomach pH. It is more toward the alkaline nature. And again they will do that barium study. These are serial X-rays taken for your stomach to know if there is any problem, there is any reflux or not. So these are the treatment and precautions. So again I will tell that it is treatable and preventable disease with a proper lifestyle modification, proper food habit, and again a proper sleeping pattern. So that is also very important. If you should not go 2 hours, not go to bed after eating
immediately
the food.
After dinner.
So you should
there
at
should
least
be some gap between.
someone says it should be a 2-hour gap.
2 hours. Okay.
2 hours gap. And again the food, taking food, it should not be a large quantity of food taken at once. The food, it should be divided in frequent small meal rather taking a large meal. So 5 times or 7 times a day is a better option rather taking a 3 times and in a large quantity. And after each and every meal, you should never lie down directly. If you are suffering from GERD or acid reflux, the head end of your cot, of your bed should be raised by 6 inches above the leg end. So you can use a brake or anything to just raise your head end. Never use a pillow below your neck or below your shoulder to raise, because again it will bend your posture and your stomach will again push up the acid content in the esophagus. So the main focus is to incline yourself so the acid from the stomach doesn't go back to the esophagus and go downward. So you just have to raise your bed end by putting something at the head end level, so by 6 inches. And so these are the sleeping patterns. So sleeping pattern, food habit, stress management will help to reduce the acid refluxes and prevent GERD.
So thank you so much, Doctor, for explaining to us in detail about GERD. I'm sure all our viewers find this information very valuable. Thank you so much. Appreciate you taking the time out to be with us today. Thank you once again.
Thank you, ma'am. Thank you, ma'am.
So friends, as Dr. Taj mentioned, GERD is something which can be treated. It is curable, it is preventable. It's in your hands. You can choose to lead a healthy lifestyle, avoid caffeine, alcohol, smoking, have a healthy lifestyle, and be assured that GERD is kept at bay. So till we meet again next time, this is Anupama signing off. Good night, stay safe and stay happy.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 38